What Stephen Strasburg had, what he injured was something called the medial collateral ligament of his elbow, which is a ligament on the inside of the elbow that connects the arm bone to one of the forearm bones. And what happens is that ligament essentially tears in the middle of the ligament during an activity, throwing or trauma. And what occurs from that is the arm doesn't have the ability to get the velocity for throwing, and it causes pain. And so when that happens in a thrower, it's a devastating injury because it's not something that typically will heal on its own. So the traditional surgery for someone who tears their medial collateral ligament is now called the Tommy John surgery. And what that is it's a reconstruction or making a new ligament to go in place of the one that was torn. And what we typically do is we'll take some tendon from the forearm or the leg or somewhere and make a new ligament from that tendon. And the ligament is shaped and placed exactly like the one that was injured, where it goes, and then it's got to heal and they recover. And so it's a fairly common procedure done for throwing athletes that injure this, and it's evolved considerably in the last 30 years, and it's now a very predictable procedure in terms of outcome and getting patients back to throwing. So the standard recovery time for a medial collateral ligament reconstruction or Tommy John surgery is about 12 to 18 months. There's a period of healing and then a period of stretching and muscle strengthening, and by 6 to 9 months most people are back on a throwing regimen, and by 9 months to a year are back on a mound building up their endurance. And most pitchers get back to professional level throwing or high level throwing somewhere between 12 and 18 months depending on the recovery and everything else. Most throwers, 85 to 90% of throwers, can get back to their pre-level injury of function. So that's a very successful thing for such a high-level athlete at this stage of their career. So the likelihood is he'll get back to throwing and have hopefully a good career. It's not just the ligament reconstruction that has to work. The mechanics of the shoulder and throwing have to be reestablished. They have to gain their endurance back of their shoulder and elbow muscles. They have to gain their strength back and their flexibility. All of those factors are very important for his overall outcome. And so for a young person, the odds are better than someone who's at the twilight of their career and being able to come through this procedure and get back to their activity and their functional level.